Good afternoon. Today is Tuesday, November 10th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today are Jamie Hamlin, Director of the Oswego County Veterans Service Agency, and Diane Oldenburg, Senior Public Health Educator for the County Health Department. This week, we've seen a dramatic increase in COVID virus activity. The Health Department's disease investigations show that what started out as a small community cluster started to spread very quickly through social gatherings about a week or 10 days ago. We now have more than 130 active cases and nearly 600 people in isolation or quarantined. Every one of us and every business and organization should be complying with the state and local directives to control the spread of COVID-19 in our county. Everyone needs to be aware that with the rate that COVID is spreading in the county, we may soon have more restrictions on public gatherings and other activities. Yesterday, New York State classified a large section of Onondaga County, our neighbor to the south, as a yellow zone. In a yellow zone, group gatherings are limited to 25 people, schools must increase COVID testing, bars and restaurants close at midnight, and restaurants can only serve 4 people at each table. The new restrictions were established by New York State to prevent microclusters from spreading. The restrictions are based on the area's rate of infection. In Oswego County, we would be placed in a yellow zone if we have a 7-day rolling average positive rate above 3.5% for 10 days, and we have 15 or more new daily cases per 100,000 residents on a 7-day average. Currently, our 7-day rolling average of people who tested positive for COVID in Oswego County is 2.1%. We haven't reached the yellow zone threshold yet, but it's very possible we will soon. Let's do everything we can to prevent this from happening. No one in Oswego County wants to see business restrictions, layoffs, and an economic slowdown again. We can avoid that situation if each of us do everything we can to reduce the spread of the virus. I want to thank the Health Department's public health team for their professionalism and dedication to their jobs. We have nurses and other public health staff members working through the weekends to investigate new cases, contact patients, answer questions, and follow up on quarantines. Nurses continue to serve hospice patients and other public health needs. Many of the staff have worked 10 or more days without a day off. Their professionalism is making our community safer, and we appreciate their commitment to our community's health. And now Diane Oldenburg will give us more information on how we are faring with the spread of COVID-19.
Thank you, Mr. Chairman. To start with today, I want to emphasize that anyone who participated in Halloween activities who is now experiencing COVID symptoms needs to be tested for COVID-19. Symptoms include fever, cough, shortness of breath, headache, sore throat, muscle pain, fatigue, new loss of taste and smell, and gastrointestinal illness. Not everyone experiences all of these symptoms, and it takes time for symptoms to develop. People who have symptoms should contact their healthcare provider to make arrangements for testing. Anyone who is tested should self-quarantine and stay home until they receive their test results. Most of us are now making plans for our Thanksgiving holiday. We hope that people are learning how quickly COVID can spread through small groups. It's important to limit the size of your gathering this year. The safest way to celebrate Thanksgiving will be to celebrate with people in your household. If you do plan to attend a gathering, bring your own food, drinks, plates, cups, and utensils. Wear a mask and safely store your mask when eating and drinking. And avoid going in and out of areas where food is being prepared or handled. These steps will help prevent a surge like we are seeing from Halloween activities. As of today, we've had 68,125 COVID tests performed, 980 positive tests returned, 162 active cases. We've had 813 residents released from isolation or quarantine. We have 5 deaths related to COVID. We've received 66,936 negative test results. And we currently have 653 residents in mandatory isolation or quarantine. For our latest antibody testing report, we still have a positivity rate of 2.5%. A total of 3,569 antibody tests have been reported to the County Health Department with 91 positive results. Our department continues to staff the COVID hotline. Anyone with questions about COVID can call the hotline at 315-349-3330, weekdays between 8:30 a.m. and 4 p.m. Thanks.
Thank you, Diane. Tomorrow is Veterans Day. I want to thank the 12,000 veterans who live in our county. Each of us knows at least one veteran, whether it's a spouse, a parent, a child, a friend, or a neighbor. Some served in war and others in peace. Some made the choice to enlist and others were drafted, but they all wore a uniform and made untold sacrifices to protect our nation during the time they were in the military. On Veterans Day, I ask each person to take a moment and thank a veteran. They deserve our respect and gratitude every day. I invited Jamie Hamlin to share some thoughts about our veterans in Oswego County. Jamie?
Thank you, Chairman Weatherup. Our county and our nation's veterans contribute to society in many ways, not just during their time in active duty. Throughout our history, military service members have put on their uniforms to protect the values and liberties that this nation was built on. But that does not stop once the uniform comes off and their time in active duty has ended. Veterans take the lessons they have learned and the experiences they have gained and continue their service to our nation by applying those lessons and strengthening our communities. Veterans have become some of our nation's most important leaders, scientists, and entrepreneurs. They are the most active volunteers working to improve communities across our country. Service goes beyond the uniform. Oswego County has approximately 12,000 veterans, many of whom are extremely active in their communities. 2020 has been an interesting year, and although there may not be parades or large ceremonies as we are used to, that does not mean that we stop showing our support. Find a way to connect with a veteran in your life using alternative means. They'll appreciate the connection nonetheless. This Veterans Day, we honor the men and women who have worn their uniform, who continue to serve our country. Please visit the Oswego County Veterans and Oswego County Veterans Service Agency Facebook pages to view events happening in our community tomorrow and this weekend. You will also find a listing of local restaurants who are offering Veterans Day meals. Many are offering call ahead and takeout orders to make it more convenient and safe for our veterans. Thank you for all that you've done and all that you do. Happy Veterans Day.
Thank you, Jamie. In closing, it's worth repeating these important steps that we should all follow to reduce the spread of COVID and avoid our communities being placed under restrictions again. Stay home if you are sick and keep your children home if they are sick. Wear a face mask or covering over your nose and mouth. Avoid non-essential gatherings of all types. Keep 6 feet away from other people. Wash your hands often with soap and water for at least 20 seconds, especially before eating. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Avoid touching your eyes, nose, or mouth. Clean and disinfect frequently touched objects and surfaces. Avoid close contact with people who are sick. And call your health provider from home if you're experiencing symptoms such as fever, cough, or shortness of breath. Do not go to the emergency department unless you are experiencing life-threatening conditions. Again, thank you to our veterans. And thank you all for doing your part to keep Oswego County healthy and open.